Have you ever wondered what would happen if you drank apple cider vinegar before going to bed? Maybe you've seen the headlines online. Maybe someone told you it could help with weight loss or digestion, or even balance your blood sugar overnight. And maybe you're curious or even a little hesitant because the idea of drinking something acidic right before sleeping doesn't exactly sound comforting. I want you to know that what we're about to discuss isn't just another trend or quick fix tip. I want to give you a clear, calm, and honest look at what actually happens when you drink apple cider vinegar before bedtime and how it can affect your body, your sleep, and your overall health. First, let's take a moment and just think about this. Apple cider vinegar, or ACV, is made through a fermentation process where natural sugars in apples are converted into acetic acid. That acetic acid is what gives ACV its sharp taste, its strong smell, and many of the effects it has on the body. But it's also the reason we need to be careful about how we use it. Drinking it straight or in large amounts, especially before bed, can create effects that aren't always immediately obvious. And while some people swear by it, others find it uncomfortable or even harmful if not used properly. Now, one of the first things to understand is how ACV interacts with digestion. When you drink it before bed, it enters your stomach, and that acidic environment can help signal your digestive system to start working. For some people, this can be beneficial. It may slow down the absorption of sugar from your dinner, which can help moderate blood sugar levels overnight. There's some evidence that acetic acid can help with insulin sensitivity, meaning your body can manage glucose more efficiently, which is particularly interesting if you're someone concerned about blood sugar spikes. But this effect isn't universal. Your body's response depends on a variety of factors: your overall health, whether you have issues like acid reflux, gastritis, or sensitive teeth, and even the timing and amount of ACV you take. Here's an important point: drinking ACV before bed isn't going to magically melt fat while you sleep. That's a common misconception floating around online. Weight loss is a complex process that involves your total diet, your activity levels, your sleep, and your metabolism. What ACV may do in some cases is support a feeling of fullness, which could reduce late night snacking and potentially help you maintain more stable blood sugar levels. That might feel like a small advantage, but it's not a substitute for a balanced lifestyle. And the effects tend to be modest, not dramatic. Something many people don't think about is the potential impact on your esophagus and teeth. The acidity in ACV is strong. Drinking it straight before lying down can sometimes cause irritation, heartburn, or even damage to tooth enamel over time. If you're someone prone to reflux or GERD, drinking ACV before bed could actually make things worse, not better. That's why it's usually recommended to dilute it in water, at least 1 to 2 tablespoons in a full glass of water, and to rinse your mouth afterward or drink it through a straw. This simple step can make a big difference in preventing irritation and protecting your teeth. Another factor to consider is your sleep itself. When you drink anything acidic right before bed, it can increase the chance of mild discomfort, which might affect your ability to fall asleep or stay asleep. Even subtle effects like needing to use the bathroom more frequently or feeling a bit of stomach gurgling can interrupt your natural sleep cycle. Sleep is incredibly important for overall health, metabolism, and recovery. So if drinking ACV before bed disrupts it, any small metabolic benefits might be offset by poorer sleep quality. But let's also look at the potential benefits because ACV does have some interesting properties. One of them is its effect on digestion and gut health. ACV contains small amounts of probiotics and prebiotics from the fermentation process, which can support your gut microbiome. A healthy microbiome is linked to better digestion, improved immunity, and even mental health. Drinking ACV before bed might gently support your gut overnight, giving your body a chance to process the foods you ate during the day. For some people, this can lead to less bloating or a calmer digestive system in the morning. There's also evidence suggesting that ACV can help regulate blood sugar when consumed with meals, and some studies indicate that taking it before bed can help lower fasting blood sugar in the morning. This is particularly relevant for people with insulin resistance or type 2 diabetes. However, this effect is usually small and it's not a replacement for prescribed medications, dietary changes, or lifestyle interventions. Think of it as a gentle support, not a cure. And as a doctor, I always want you to approach these kinds of remedies with a balanced perspective, informed, cautious, but open to small, safe benefits. Let's pause for a moment and talk about the type of ACV you should use. Not all apple cider vinegar is created equal. Look for the unfiltered organic variety, with the mother still intact. The mother is a colony of beneficial bacteria and enzymes that contribute to some of ACV's health properties. Filtered or pasteurized versions may still have acidity, but they lack these potentially beneficial compounds. Even so, the primary effects like blood sugar moderation come from the acetic acid itself, not the probiotics. So while the mother is nice to have, The acidity is what matters most for most of the effects we're discussing. Another thing people often overlook is dosage. Less is usually more with ACV. 1 to 2 tablespoons diluted in water is sufficient. Taking more doesn't make it work better and can increase the risk of side effects like digestive discomfort, throat irritation, or changes in potassium levels over time. If you're on medications, particularly diuretics, insulin, or heart medications, it's very important to check with a healthcare professional before making ACV a nightly habit. It can interact with some drugs, and while rare, these interactions can be significant. Now, I want to be honest about one of the less talked about effects. ACV can, in some people, influence acid-base balance. That sounds complex, but basically your body maintains a very tight balance of acids and bases. Drinking ACV, especially in large amounts, can shift this balance slightly, which is usually harmless for healthy people, but could be an issue if you have kidney problems or metabolic disorders. This is another reason why moderation is key, and why consulting a professional if you have any underlying conditions is the safest approach. Something I see often in my practice is people hoping for a magic overnight detox or metabolism booster. ACV is not magic. It's not going to cleanse your body or burn fat while you sleep. The truth is that your body detoxifies itself every day through the liver, kidneys, lungs, and skin. ACV can complement healthy habits like a balanced diet, regular exercise, and good sleep, but it doesn't replace them. The best results come when it's part of a consistent, healthy routine, not as a last-minute bedtime trick. So, what's a safe and practical way to incorporate ACV before bedtime if you want to try it? Here's what I often recommend to my patients. Take 1 tablespoon of ACV in a full glass of water, maybe add a little honey if the taste is too strong, and drink it at least 30 minutes before lying down. This allows your body to start digesting and reduces the chance of reflux. Avoid drinking it straight or taking more than the recommended amount. Pay attention to your body. If you feel heartburn, stomach upset, or any discomfort, stop and reassess. Everyone's body is different, and what works for one person might not work for another. One interesting observation is how ACV may affect appetite overnight. Some people notice that drinking it helps them feel a bit fuller, reducing late night snacking. This can indirectly support weight management by preventing excess calorie intake before bed. It's subtle, but for people who tend to graze in the evening, this small effect can be helpful. Remember, it's not a replacement for healthy meals or portion control. It's just one small tool in your toolbox. Now let's address a common question. Can ACV help with bloating or digestion if you have eaten a heavy meal? In some cases, yes, the acidic environment can promote digestion and help break down certain foods more efficiently. Some patients report feeling less bloated in the morning when they take ACV before bed. However, if you already have acid reflux or gastritis, it might have the opposite effect, making symptoms worse. Again, it's very individual. The key is to observe how your body responds and adjust accordingly. There's also a psychological aspect that's worth mentioning. Sometimes the act of drinking ACV can create a sense of routine or control over your health, which can be reassuring. When we feel proactive, it can positively affect our habits. While this isn't a physiological effect, it's real, and it's part of how people perceive benefits from small health practices. Now, I want to pause and highlight a very important truth. ACV is not suitable for everyone. Pregnant women, people with ulcers, severe reflux, kidney issues, or certain chronic conditions should avoid regular nightly use unless cleared by a doctor. And again, if you take medications like insulin, diuretics, or heart medications, you must check for interactions. Safety always comes first. As we think about the bigger picture, it's worth noting that ACV is just one piece of a larger health puzzle. Nutrition, hydration, movement, sleep, stress management, these are the pillars that really move the needle on your health. ACV can support some of these areas in a small way, but it's not a primary driver of health on its own. So if you choose to try it, do so with intention. Start small, dilute it, observe your body's response, and use it as a complement to a healthy lifestyle. Don't expect dramatic overnight results. Look for subtle improvements, steadier blood sugar, less bloating, or a slightly reduced appetite before bed. These small changes over time can add up, but only if they're part of a consistent, mindful routine. And finally, remember this, your body is resilient and it communicates with you constantly. Pay attention to your energy levels, your digestion, your sleep quality. If ACV improves these areas, it may be a helpful tool. If it causes discomfort, stop and reevaluate. There is no one-size-fits-all answer, but with careful observation, you can find what works best for you. I want to leave you with this thought. Health isn't about chasing every trend or quick fix. It's about consistent, safe, and informed choices. Apple cider vinegar before bedtime can be part of that, but only when used thoughtfully and with respect for your own body's signals. Approach it with curiosity, but also with caution, and you'll find whether it truly benefits you. So if you've been wondering whether that nightly ACV ritual is safe or effective, now you know the nuances. It can support digestion, help with blood sugar moderation, and possibly reduce late night snacking. But it can also cause reflux, irritate teeth, and isn't suitable for everyone. The key is moderation, timing, dilution, and listening to your body. Start small, observe the effects, and make adjustments based on your own health and comfort. At the end of the day, the most important thing is that you feel safe, informed, and empowered in your choices. Your health is a long-term journey, and no single habit, supplement, or remedy will replace the foundational practices that sustain it. Use ACV as one small piece of your routine, not the centerpiece. And remember, when in doubt, reach out to a healthcare professional who can guide you based on your unique situation. Take care of your body, listen to it, respect it, and with informed, consistent choices, you can support your digestion, your metabolism, and your overall well being safely and effectively.